Welcome to Early Intervention Matters, the podcast that helps parents, teachers, and health professionals understand the diagnosis, treatment, care, and support of children with autism, ADHD, Tourette's, and other neurodevelopmental challenges. Your host, Dr. Inyang Takon, is a consultant neurodevelopment pediatrician, and she will provide insight through interviews, answering questions, and breaking down complicated topics. By sharing stories from parents and professionals in the field, we hope to make sense of what can be an overwhelming topic. Early intervention is crucial with children with developmental difficulties. Yes, early intervention matters. And now, here's your host, Dr. Inyang Takon.
Welcome, everyone. Thank you for joining us for today's session of Early Intervention Matters podcast. This is a podcast for supporting children with different neurodiverse conditions and also supporting families and carers of children. We're very fortunate today to have Mayuri Dave. She is a highly experienced specialist speech and language therapist. And Mayuri will say a quick hello, and then I would introduce her because she's going to be giving a lot of insight into the topic that we'll be discussing today. So over to you, Mayuri.
Yes, hello. Hello, Dr. Takon, and hello, everyone. It's my pleasure to be here today.
Thank you, Mayuri. We're very fortunate to have you today, and I'm sure many of our families have been waiting for this episode because they've got lots of questions, which hopefully we'll be able to touch on. So Mayuri is a highly experienced specialist speech and language therapist. She's also a qualified systemic family practitioner and clinical quality lead for neurodiverse children. Mayuri has over 30 years expertise in working with children and young adults who present with complex neurodevelopmental disorders. And this includes autism, mental health and behavioral challenges, learning difficulties, and other behavioral concerns like behavioral eating concerns. She's recognized for her leadership in clinical settings. She's successfully coordinated and delivers speech and language therapy services across special schools, mental health services, and community clinics in Hertfordshire, UK. As a clinical innovator, Mayuri developed the communication framework, which is an assessment and intervention package. This has become an essential resource within the Hertfordshire Speech and Language Therapy Service and Special School Service. This framework helps empower clinicians, education staff, and parents to integrate and apply functional communication programs seamlessly into everyday learning environments. So I'm sure we've all heard from Mayuri's experience and expertise, and I'm sure that we'll be able to learn a lot from her experience today. So welcome again, Mayuri, and thank you so much.
It's my pleasure. It's my pleasure, Doctor.
Thank you. So today we're talking about speech and language development. And we know that there is such a wide prevalence of speech and language disorders. One of the commonest concerns that present to the doctors, including the GPs and the specialists, is speech and language delay. Families are very worried when their child is not talking when they should be. And as you know, communication is one of the greatest tools of opening yourself to the world, understanding the world. So I just want you to take us through a bit of that journey by giving us an overview about, you know, language development. What are the critical points of language development, and just giving us some of those key things.
Yes, it is. It is of quite a complex area, language development, because it varies so much. Each individual child may progress at different rates. So it's very important to note that whilst we understand that there are kind of general patterns and key milestones that we expect children to be developing their speech and language skills, there can be within that quite a wide variation with children. But then from a young age, we expect babies to be communicating. So the expectation is that a young baby between the ages of 0 to 6 months is able to recognize familiar voices, is able to recognize and respond to familiar adults, familiar people around them. They may recognize the mother's voice. By the age of 6, 7 months, you may see them starting to smile. There is sort of parents are beginning to understand some of the sounds that they're making. And then by the age of 12 to 18 months, not real words, but what we call pseudo words may start to come, It's almost related to babbling, like baba, dada, gaga. And adults are beginning to put meaning onto it, so it becomes meaningful. But the key skill at that age we often see is they're beginning to imitate. They're beginning to imitate familiar words. They're beginning to imitate, some of the actions that people are, others are doing with them. And you start beginning to kind of understand a little bit more of what they're trying to say. So by the time that they are 24 months, around about 2 years, there's a growth of words, vocabulary developing. The general expectation is that they should have about 50 to 100 words. So, even there's quite a variation. You will start to see them trying to combine words together into simple phrases. So you may hear language like biscuit, want biscuit, big ball, choo-choo, there choo-choo, that kind of very basic, simple level. But you may find that the speech is still very unclear. So, I often find those children coming into the clinic and I'm asking the mother, I'm sorry, what did they say? What do you think they're trying to say? And then as they enter into nursery, preschool, their language is beginning to expand. The single words are moving into kind of simple phrases and very simple grammar is beginning to emerge. They may use verbs. They can talk about things that are here and now, so present tenses. And it's an age where they may start to show curiosity. So their questions are forming, what's that? Where? Very simple. So by the time they get to school, 5 years old, you would be expecting them to having a good range of vocabulary, but their speech may still not be very clear because speech sounds take time to develop, but they are showing interest and motivation in that social communication, in playing with others, playing with other children. They are able to tell familiar adults, how they may be feeling. They may be asking that lovely why question. Why this, it? And just the general language rules are just beginning to form with a little bit more structure and clarity. So really, language continues to develop right up until they're about 7 years old. And I think concern is when parents don't see that, when they're comparing other children and they're wondering, why is my child not doing the same? And it's always good advice to go and seek help. Go and speak to your GP, go and speak to your local, drop-in speech and language therapy clinics if they're running in your area, because it's always good for somebody to have a look at how the language and speech is developing. Is it following the general expectations that we are wanting or we understand to be? And also, language is very much influenced by many other factors as well. A key thing for language is children to have real good grounding in their attention and listening skills. So sometimes, as you know, Dr. Takon, when we see children coming in, they're not responding, they're not doing, we often have and ask ourselves, could there be some hearing issues here? What else is going on? So, every child is different. Every child follows their own, progress at different levels. But the main thing is being mindful of what can we do to support them.
Thank you. Thank you, Mayuri. That's so important. I think from what you've said, it's quite key to have an expectation of or to know what should be coming at different times, but also know that the language development is evolving, and that, because one child does it quicker does not mean the other child may not still develop their own pattern. I think that's usually one of the challenges, isn't it? When you feel, oh, your child is not saying so much at a particular time, some parents get really worried. And we do see this as well,
Absolutely.
where
Yes.
a child may not be speaking initially, and then the next time, next few years, that child is a chatterbox, and the parents say they're talking excessively. So that it's quite interesting, but I think it's something that parents need to take on board, that every child's trajectory is different. But when you feel that things are not following the usual pattern, it's good to seek help. And I think
It is.
one of the things you have emphasized is language is based on other things. So if that child is not listening, what could be going on there? It could be something like getting the hearing check. And I'm sure, as you and I would have seen in our profession, that there are many times where children have had really bad hearing loss where it's not been picked up and the language hasn't developed, and that child is completely, they're not hearing, so they can't, the brain cannot process that
Yes.
information.
Absolutely. And it is vital that listening is so important.
Yeah.
And that ability to be able to show interest and attend to something is so important. And if you can't hear very well, it's very difficult.
And I think one of the things you touched on again earlier in the language development was the issue about children imitating, sounds, which again brings the role of the parents in, language stimulation as well.
Absolutely. And, the therapy process, I mean, you may have heard me quite often repeat so many times, is getting parents to be, how can they be responsive? How can they create opportunities to be responsive so that the child is able to process, understand, and then be able to hopefully express in their chosen way.
Yeah. That's really important, because sometimes we're waiting and saying, okay, when is the child going to do certain things, going to talk, but what can we do in that process with supporting that child? Yeah.
Yes.
So the other thing, as we know, many times when children have a delay in their language, there's certain things that goes on, worries that go on in parents' minds. And one of the common things, I think, because of how common it is now and how much we will hear about it, once a child is having delayed language, parents begin to get worried that could the child have autism spectrum disorders. How can you shed more light on how to distinguish a child that's just got language delay and a child with language difficulties from ASD, or could it be both?
Yes, it is a challenging area, distinguishing between language delay and, attributing some of that to a child with autism. And there is an overlap. There can be an overlap. However, there are some key differences in how children with language delay. With language delay, they may struggle to express themselves, but they understand language in the appropriate way. And they're able to use language, whatever little language they may have, to interact with others. So that social skill, that social interest is there. They are able to kind of follow simple instructions, even though their language may be limited. Whereas a child with autism, that's the area they may struggle, because they can't connect with what is said to them. They can't connect with the expectations of what is being requested of them. I wouldn't say there's a lack of interest, but they struggle to form that interest, which is why quite often parents are supported to understand that if your child is autistic, you need to engage with them at their level, at what they are showing interest in, so that the language can connect to them. There are other differences. A child with language delay will have much more, they will be using nonverbal language. When I say nonverbal language, we are talking about things like they'll be using their facial expression, they'll be smiling, they'll be communicating in other ways, they'll be making eye contact that is sustained and communicative. If there is joint attention, they'll be looking at you, they'll be looking at the object, making sure that you are understanding what they want or what they're interested in. They'll be using gestures. So it will not be a gesture that is prompted. It will be a spontaneous use of it. With language delay, it's much more fluid. Whereas with autism, some of those things take time and may not always be used in everywhere, in all environments. It may only be used in environments where they've learned to use it. So there are those kind of subtle differences. One of the other things about language in some children with autism is when we talk about imitation, I think we often talk about children who are echolaic, and it's either immediate or delayed. When we say echolaic, what we say is they're repeating words they've heard. So they may, and recent understanding that we are developing is that it is a form of communication.
Mhm.
It's just that they're not connecting it at the right time, or it's initially used in a repetitive way because they're trying to make sense of it before it becomes meaningful and interactive for them.
So it's not something that people should be trying to stop, because I think
Yeah.
previously the people would be trying to discourage that, isn't it?
Yes, that's right. Although as clinicians, we haven't ever discouraged it, but we have tried to shape it in a sense so that it becomes meaningful. But now we've got more understanding. We've had better research studies to help us understand that it's early form of language development for autistic children. They're learning to play with it. They're learning to make sense of it. And what they're doing is, instead of learning it in the normal pattern of single words, 2 words, 3 words, joining sentences, they're learning it in chunks.
It's very interesting. So what Mayuri has mentioned, this latter part of the discussion about children being eclectic, is the repetition of words, where children might say something that somebody has said, or they might use those words. They might say it immediately after someone has said it, or repeat those phrases which you've heard from someone at other times. What used to happen is sometimes families will be concerned that they are probably just stuck, and just that they're not progressing with their language. But I think it's quite interesting, with what Mayuria said to us, is that actually it's a form of their pattern of language development, and they're playing with those words initially, and eventually it's also helping to form part of the pattern of their own language development, which is quite interesting. And I'm sure there are lots of children with this pattern. So it's quite important that we have a better understanding of it. And I think you mentioned some key things. It's a social context for a child with language delay without social communication concerns that helps to distinguish, whether that pattern is just a language delay or there's some underlying social communication issues. So we see that. We see some children whose language is delayed, but they're connecting. They are, they're showing their parents what they want. They're interacting. They want to interact with other children, even though they can't speak. They're interested in other people who come into the house. They want to connect.
Yes.
And I think that social aspect, which a child with pure language delay displays, is quite helpful to understand, and, to help other people dealing with a child to understand.
Yeah, and often language is very much connected with play skills. A child's ability to play in an imaginative and creative way. And quite often you'll see language delay children are able to engage really, very creatively in play, pretend play like, feeding the doll, putting it to bed, going to sleep. And a child with autism may struggle. They may learn scripts that make it look like that they're engaging in play, but the pattern is quite repetitive, is quite ritualistic in the manner the play kind of plays out, like lining up the cars, and the cars have to go in a particular way into the garage and out of the garage. Whereas a child with language delay will have a lot more different kind of scripts and different, which are much, again, it's the spontaneous nature of that play as well. They're able to allow others to come in and join with them, and they're able to follow them. Whereas a child, autistic play may be a little bit different in quality with that.
Very useful information. Very useful. And I think these are things that as parents we can begin to, see what's happening, engage with the child and see and observe the child's pattern of play and observe that social aspect.
And Dr. Takon, the challenging aspect is that when there is a severe language delay or even a language disorder underlying, sometimes it's very difficult to wean out in the early developmental age stages, whether it's what is leading to what. Because even with language kind of disordered children, their play can be very rigid. Their play can be it can mimic some of the behaviors that we would sometimes observe. So that's the time when we have to be very observant and very careful in how we are supporting these children.
Yes, that's very useful information. Very useful. And so, we talked about how a child with language delay can also have autism spectrum disorder. And like you said, that sometimes can be quite difficult to tease out. So how do the children in that case present?
Can you please clarify?
Child has both features of autism spectrum disorder and also has, I think you've mentioned, they might have quite severe language delay and all that, and autism as well. So what would you say, how would the children then present in those situations?
They would present quite rigid in their behaviors. You would see lots of repetitive behaviors. There is lack of social engagement. So they may respond to kind of learned scenarios, but the minute you bring some changes in, you don't see that, that they're not able to respond. They're not able to the language is very repetitive. There's lack of eye contact, lack of facial expression. There's lack of responsive social smiling. There's just that general lack of interest in the social engagement, the to and fro conversation, the engagement that takes place. There's difficulty with shared attention. They're not able to keep hold of that attention. Or if attention is there, it's very much on their part. It's driven by their interest and themselves. Whereas when it's just language delay, there is a little bit more engagement, social attention.
That's very useful. And I think this is what parents need to watch out for. I think when a child's language is delayed or we feel that it's not progressing the way it should be, in the child's engagement with the parents at different times, and just parents being observant of that child's, how do they request things, what do they do when they want something, when they need something, are they communicating with you in a to and fro way?
Yes, absolutely. I think when I'm sort of working with these children, sometimes it's the level of effort that you have to put in with the autistic child that kind of tells you the struggle that may be taking place in building rapport, in building that to and fro conversation with them or interaction in play, in whatever level it is at. It's very effortful.
You're having to work very hard at getting them to communicate. Whereas if the child is free flowing communicating, you just find you're probably just doing.
Yeah. And a child with language delay will not have that same level of rigidity. It is there, but not the same level.
Yeah.
The minute you kind of put in the scaffolding, the responses, you start seeing things coming through.
Yeah, that's very interesting. And before we move on, so we also have the category of children who sometimes will speak at home, but when they're outdoors, they do not speak and do not talk. Can we just talk briefly about the children? I'm sure you talk about them a bit more, but most children, people describe them as being mute, selectively mute. So could you shed more light on that?
Yes, again, it is understanding what is the core, what is the driver in stopping these children being able to communicate in different environments. So often we see these children speaking at home with their families, they're very comfortable. It's because they feel safe, that it's familiar to them, and the anxiety is very low. As soon as the social demands increase when they go into the school, it's new, they're unfamiliar. It's actually driven by anxiety, the levels of anxiety, and those children actually require very careful support and very careful monitoring and very careful strategies to be identified to support them. Sometimes it is helping them to look, sometimes is it driven by language difficulties? Is it driven by social difficulties? Or is there something else?
Because
And it is often that fear of actually doing some, communicating.
because
Is it to do because they don't know how to do it? Or is it something else?
And I think that's quite important because I think we've all seen children where they get into new situations and they just, don't talk as much as they talk at home, or, they're very quiet outside. So how do you distinguish that from a child who's just selectively mute?
It's again being able to carefully assess those children in all the environments and then very carefully supporting them with reduced demands. And it's looking at the quality of those demands. What else can they be supported with that can replace that verbal communication? Can they be supported with non-verbal means of communication? If they're using gestures, they're using their facial expression, if they're using pictures, symbols, words, all those things are supportive because it reduces that demand.
It's very useful because I think you've touched on something really important. The natural tendency when people see a child who's not talking is to talk
Yeah.
more to the child
It is.
and want to get the child to talk.
It is assessing what is the demand that they're struggling with.
Yeah.
And what is the underlying driver that is creating this difficulty.
I think that's so important. Even for some other children who are not selectively mute, sometimes they get to a place, like schools, and people are saying, oh, they're not talking, they're not saying anything. But at home, they're doing more communication. So I think what you said is so important for people to realize when they're in situations where there's a lot of demands on them, they get worn out.
It is. And also there is unpredictability attached to talking to people outside the home. You don't know what the intentions are, what they're going to be saying. Whereas at home, you're in a safe place. You are with familiar people.
Yeah.
You are not going, whatever you are able to do and say is accepted as well.
Yeah.
It's accepted outside as well, but there is that internal fear that is driving, the internal anxiety that is driving somebody not to speak.
Yeah.
But it's very complex. We cannot generalize it because it is individual to each individual child, to each individual environment.
Yeah.
And it's also looking at the patterns of that adult-child interaction as well, to be able to identify how they can be supported in an effective way, in a nurturing way.
Okay. Very, very useful information. Coming down to, at what age would you say children can start accessing speech therapy?
They should be as early as possible. Preschool, definitely.
Okay.
At the age of 2 to 3 years, when we are beginning to recognize some of those early developmental skills, that actually they're not attending. Actually, words are not coming. I'm struggling to understand. There's temper tantrums taking place because they appear to be frustrated, not being able to be understood. I think parents should be accessing help when they are concerned, regardless of whether the concern is appropriate or not.
Yeah.
Because even going to see a speech and language therapist or another clinician, an early school clinician, early development clinician, should be able to give you support in understanding where your child is at. How much of that is appropriate? How much of that is of concern? What can you start doing in order to help that?
Fantastic. So coming down to um we know that speech and language therapists are very few and far between. It's and sometimes the expectations of what the speech therapy should be doing is very different. So in your view, what's the role of the speech and language therapist, number one? And how often should, I know that question is going to be variable, but we know that there's sometimes some families are accessing therapies on a weekly basis, and some, less frequently. So there's just a confusion sometimes with parents. Some parents may feel my child is not getting enough. Some parents may be getting the child to have speech therapy very often. So what do you think? First of all, what's the role? Just to explain to parents what speech and language therapists do when they're working with a child with speech and language delay.
First and foremost, what they do is they assess to work out what is it? Is it a delay or what else it is? Once they realize what it is, if it's a speech delay, then they will be giving advice on how to support that. Direct speech therapy is not something that is effective on its own. And it is a speech and language therapist's decision is very variable because there's so many different factors to take into account. However, a speech and language therapy intervention should not just focus on therapy sessions. It should focus on how adults in the education environment, how parents at home are able to follow the strategies that the child requires to follow. So quite often I find parents really struggle with that because it is like they are exhausted. They need support to understand what is it that they need to be doing. But it also requires support in translating into a normal home routine environment. Similarly, teachers equally require support to know how to integrate the advice and the strategies into everyday learning scenarios, situations, so that the child is supported all the time, everywhere.
That's important. Supported all the
And
time, everywhere.
yeah, yeah. And the frequency of those therapy sessions is often taken on the progress the child is making. How much is the progress? If the progress is slow, then the sessions are not many. But if the progress is fast, the child is responsive, making good progress, then the therapist may offer a little bit more intensity in individual sessions.
Oh, that's interesting. So that's almost like the reversal of what people think. Because people
Yes.
think not making quick progress, you need more
Yeah.
speech and language
Yeah.
therapy.
Yeah. Because think about it. We cannot push the child beyond what they can manage at that moment in time. If we put more demands, then we are creating a problem. So we have to go along with the child. We have to follow the child's lead.
That's interesting. That's interesting. That's very useful.
And quite often, the intensive speech therapy is given to children with language delay and maybe speech difficulties. So the speech sounds have not matured in the same way, and their speech remains unintelligible, and there is an awareness on their part coming in that actually I'm different. There's something people don't, and frustration is rising. It is at that time that a speech and language therapist is likely to consider. Otherwise, it is advice and strategies to parents and teachers to do it in a normal way as possible.
That sounds very useful. I think one of the things that has come out of this discussion is that having for a child with language delay who's not making quick progress, putting more and more speech therapy, because sometimes people will say, I need more speech therapy sessions, and people will have, twice a week or even more sessions, that it doesn't equate to progress. And sometimes it can be counterproductive because
Yes,
putting more and more demands on a child who has not reached that level is actually overwhelming the child a bit more.
that's right. Yes. Yes.
And the other thing you said is the application of that language advice should be everywhere the child is and not just in a session.
Yes. Yes. And you'll quite often hear therapists talk about creating supportive environments.
Yeah.
Teachers will talk about supportive environments, communication supportive environments.
Yeah.
And it's for that reason. And remember, autistic children do struggle to generalize.
Yes.
If language is learned in one environment, language then has to be taught again in another environment.
So they can't translate what they've moved from one to the other.
No.
Okay.
So therefore, it requires strategies for adults in how they respond in what they do in order to support that.
Very useful information. Some families have been concerned. So if their child is not developing the speech and language skills and it's delayed, some families have felt, well, the child is never going to acquire language. Is it ever too late to acquire speech and language skills?
It's never late to acquire speech and language skills. The rate you may acquire may be impacted because this is why earlier the intervention, the better. The brain is most flexible and adaptable in the early years. However, we know with all the demands and all the struggles that some of our children have, it is more important that they're supported with language-rich environments because language can come through any time. And the language comes through when they're able to connect with the expectations of what is happening to them.
Very important. Very important.
Yeah. I know when I was working in special schools, I know some young people suddenly at the age of 12, 13, don't know, single words would come through sometimes from being completely nonverbal. And I think if we didn't keep that expectation with them and we didn't keep stimulating and supporting them, I think I wonder sometimes what would have happened. The main thing is that effort is put into supporting them. Learning opportunities, creative play opportunities are created for them to be able to engage in meaningful interactions, have responsive interactions with those around them so that they can continue to develop language. They may not express the language, but at least we're supporting their understanding of language. And understanding always precedes expressive language.
Yeah, so that's, I think, quite key to remember that.
Yeah. And Dr. Takon, as you know, even us as the adult brain still has neuroplasticity. It's still got the ability to adapt and learn new skills.
Yeah. You think about people learning new language from not learning, being able to speak, and
that's right.
yeah.
Yes. It may take longer.
Yeah.
But I think it's when things become meaningful and connecting for them
Yeah.
that you find that, suddenly language becomes meaningful to them.
Yeah.
And sometimes it's just accepting that they have a different form of language.
Mm.
They have a different form of communication.
Yeah.
And it is us who may need to adapt to them.
And I think what you said is really true, because I have seen children where I'd seen them in specialist school placements where initially they hadn't spoken for a while, and I can, and then years down the line, one of the young people I saw recently, I was just shocked about how fluent he was, how capable he was of holding a conversation with parents. And this was a young child who really struggled early on. And by this time, he was actually turning 18. But that's how long it took that language to develop. But he was now being.
And 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 the language may not be as complex
Yes.
as you and I may be
Yeah.
using language.
But it was understandable and he could communicate.
Yeah. It's got a functional quality.
Yes, definitely.
Yeah.
Definitely, he had the functional quality. He could express himself. He could talk about things, which I felt was very impressive from a child who, years back was not really and had a lot of echolalic language. That was a child who
Yes,
had a
that's
lot
right.
of
Yes.
echolalic language.
And I wonder if you were adapting yourself as well while you were having that conversation
Yes,
with
I
them.
was. Yes, I
Yes.
was.
Yeah.
I had to, I could communicate with him,
Yes.
even when the language was echolalic. But you
Yes.
see, the advanced improvements.
And these children benefit at all times with us simplifying ourselves with them,
Yes.
simplifying our language, creating that space that is a little bit longer for them to respond back to us.
Yeah.
And that makes a lot of difference.
Yeah.
And how we use our language with them also makes, quite often I'm having to tell parents not to use too many questions. Questions are incredibly demanding.
Yeah.
What are you doing that for? Why are you doing that? That is a child with language delay, or language delay in autism, or language delay in something else will struggle to communicate.
Yeah. That's true. That's true.
So it is adapting ourselves with them,
Yeah.
simplifying things.
And I think what you said is really true. Brings to mind a young child I saw not too long ago, but it was the beautiful work the parents were doing in their communication with him and how much, and it was really connecting. You've talked about connecting a lot, and it was around his interest, but they were able to promote language that connected to his interest, and there was learning going on there, and there was communication going on there, but it was centered around his interest, but they could get functional language.
Yes.
It was just wonderful to see.
And what happens I often find is that when I'm engaged with children like that, or parents are engaged in interactions like that, a child may say one word and the parent is then able to comment
Yeah.
to help them expand that language. So if they're repetitively going car, 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 they can very gently respond, green car, not what color is that car.
Yeah.
There's a difference in how you respond and what you say and how you adapt.
Yeah.
And you are using that interest to build that language and expand that language. And then that language can be transferred to another occasion
Yeah.
with something else.
Thank you. That's really informative. So, when children struggle so for example, a child with language delay, there comes a time where, children are taught other methods of communicating, like sign language.
Mhm.
I know some families are hesitant about it because they think putting in that sign
Yes.
language limits the child's ability to communicate. What's your feeling on that?
No, it does not limit. In fact, it enhances their communication ability. The best way I can explain to parents is when we talk, speech, it's disappears immediately. I just said to you, give them time to process. When we use signs or pictures or any other alternative forms of communication, what we are creating is a supporting mechanism to help them understand, process and understand. And then if they've got expressive difficulties, we are then giving them that support to use the language for either requesting things or labeling things, answering, responding to question form, whatever it is, whatever level their language is at. So signing, using symbols, using alternative forms of language, pictures, symbols, is highly, highly supportive. It does not stop anyone from learning verbal language.
That's very useful information.
It reduces the frustration in that communication cycle. And if you think about it, we said right at the very beginning, children learn through play. What do we have in play? We have play items we are labeling, we are talking about. That is visual cues.
Yeah.
When we then link that with photographs or pictures, we are then able to make it portable, to take it to a different place and still have the same language.
Yeah. So it's reassuring for parents to know that actually it's supportive and using signs and augmentative communication does not.
I mean, even in the UK, there's been a surge in baby signing classes.
Yes,
Parents go to baby signing classes and are thrilled when their 6-month-old is doing certain, asking for more or help or something like that, using signs, gestures.
Yes, that's true.
And we just said very early on, signs and gestures are a very important part of everybody's communication.
That's true. That's true. That's true.
When they're at nursery, they're taught to sing nursery rhymes, and quite often their signs and gestures connected with those nursery rhymes.
Yeah.
There's a reason for that, because it supports language development and learning.
That's true. And that's how a lot of children remember the rhymes, isn't it? They will do the actions and imitate it, and it helps them to remember the words linked with those actions.
That's right. That's right.
Yeah. That's reassuring. So our families should be reassured that using sign language does not limit their ability, doesn't block the ability to acquire language. It's supporting it.
It is like an added cue on top of the verbal language.
Good. Thank you. That's really good. So for parents within the UK who are listening, there's something called an education and healthcare plan, where if your child has additional needs that meets the criteria to have some dedicated support, that comes in form of a formalized plan which links in education and healthcare professionals working together to look at what support the child needs at school to be able to access learning. And if we think about learning, there's a lot of high speech and language content that comes in with learning because you're using it to communicate, you're using it to understand what's being taught. Moving around, speech and language becomes such a primary factor when a child is communicating with the world out there. So, and very commonly, children would have seen speech and language therapists as part of that assessment for the plan. Some parents have asked, how do they get speech therapy included in their child's educational healthcare plan? Because it isn't a one size fits all for all children. It's done according to the needs of the child. So every child, has their own different needs, and it's based on the needs of the child that is reflected in that plan. So, which is what that plan is for. It's quite an individualized plan that looks at the needs of specific children.
Absolutely, yes.
So some parents have asked, how could they get speech therapy included in their child's plan? I would think that if it was needed, it would be incorporated in there. So I don't know.
Yes. Yeah. I think now most schools and most staff have been given training. So most speech therapy services are organized on three, there is universal kind of support that they give that is available just general to everyone. So it's general strategies. Then there is the targeted level of support, whereby a speech and language therapist may give advice that can be incorporated into what the school is doing. And quite often that can be described as reasonable adjustments. What is the child's need to be able to function and be able to learn, be able to focus and learn and use language. When it comes to the specialist level, it's quite a multidisciplinary approach. The speech and language therapist role is very much to support. So the goals that they may identify need to be integrated into their learning, into their curriculum, in what they're doing, so that there is an adult in the school who kind of follows the advice.
So it's not necessarily you have to have speech therapy every week, but that speech requirement is incorporated into
Yes,
the other aspects of the child's needs.
that's right. And it still requires everyone, the parent, the school, and the therapist, to come together to review it on a regular basis. Getting it into the EHCP statement is the remit of the school and the community speech therapy service. They would need to do an assessment and be able to look at that together.
Thank you. That's very important. And I think it boils down to what you said at the beginning, that it has to be functional. It's not
Yes,
a case of, taking the child aside and just giving the child isolated therapy sessions. That language has to be incorporated into the child's day-to-day learning.
that's right. I mean, quite often you'll find speech therapy targets incorporated into some kind of curriculum work that's taking place. Either it's within the English literature with the storytelling around narratives. If it's speech sounds, then they might be playing games. It is in many different curriculum areas. They may incorporate that target. And then there may be an adult who understands how to use how to model, how use the advice and the strategies that's been given to them and incorporate them. So the child is actually experiencing a much more naturalistic form of learning.
Yeah, yeah. As well as
But the
developing
Yes,
their language skills, it's just kind of
exactly.
flowing through.
That's right. And the reasonable adjustments would be something like, access to a quiet room so that they can hear things clearly, support of visual cues we just talked about,
Yeah.
symbols and pictures, and maybe a PAC system, whatever it is the child needs to support their learning and their communication, to be able to engage in that learning.
That's very, very important. Thank you so much. I think this has just helped to, um, to open up the understanding of
Mhm.
speech requirements and speech development. Because I think a lot, the thinking is usually you get more speech and language therapy, one-to-one session, and that the more you get, the
Yes,
quicker a child's development language develops. And I think you have really explained that in such in a very good way, to say it is a functional, there's no need for having multiple sessions if it doesn't link into the child's day-to-day functional outcomes. And
yes,
that can be
yes,
delivered in the context of the learning, the home,
yes,
or the settings the child in, just remembering the things that you're doing to incorporate that, exposing the
that's right.
child.
That's
I
right.
think that's one key message from what.
And also remember, our children struggle with what we call social communication and social interaction, those peer relationships. So sometimes, that there will be advice and targets set on how to support that.
Yeah,
How can you promote turn taking in conversations? How can you promote understanding of body language so that they learn to respond in a bit more appropriate manner?
yeah.
Now, if you were to do that in a rigid therapy session,
You're not going to get that.
you're not going to get that.
Yeah, you're not going
Whereas
to. Yeah.
if everyone does it consistently at all times, there is more success with that.
Yeah, definitely. That's it. That's a very big message from today. One other thing is sometimes, and we have a lot of movements of people between countries, coming from different countries and having to integrate, and then children coming in probably have learned different languages in their home countries and coming where they've never spoken any English before, or sometimes children, the families are speaking their own native language at home, and does that affect speech development, and can
No,
being multiple language?
no, multiple language doesn't. No, there is no research out there that says that it is detrimental to the child.
Yeah.
It isn't. The language that the child learns will be very much governed by the environment they're in. And if they understand their mother tongue, then that's a positive. They will soon pick up. If they've learned their mother tongue, they will soon pick up with the right support. They will get familiar with it, and they will start to make that connection and learn the new vocabulary. And again, that's where sometimes some of our visual strategies are helpful.
Yeah.
So that they hear both.
That's true. So that's not a cause of a child having delayed development.
No, 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 no.
Good.
In fact, you see a lot of parents, if the mother speaks one language and father some other language, they're actually both speaking their own language to the child, and the child is progressing with both languages.
Yeah.
And then at school with English. So there's 3 languages.
So there is yeah.
The main thing is like we said, is giving that time, that space, and supporting them in a responsive way.
Thank you. And one of the listeners have asked that her son is nonverbal but has a few words. She felt that he seems lazy or shy to speak or may not realize the use of words, being able to get anything he wants with gestures and so on. So the audience member is asking, how can she encourage him to use words? So he has a few words, but doesn't seem quite proactive in wanting to use the word. And, the advice in what support can they give to encourage to use more words?
I think if they are using some words, they're using gestures to get what they want. That's what I'm assuming.
Yeah.
Then I think it's getting down to their level, modeling what they're saying, and then expanding their attempt by adding on another word. That's one way.
Mhm.
The other way is if they're nonverbal, they're pointing at something, they're wanting something, it's okay to go down to their level and label it.
Okay.
Give them the opportunity to hear the language. Occasionally, give them choices if they understand. And then when they make a choice, use that opportunity to label it, to comment on it. But the most difficult part, I think, for parents is being patient.
Okay.
Yeah. It takes time, lots and lots of repetition. But in that repetition, you just need to be very consistent.
Okay.
Consistency is required.
Okay. So they shouldn't give up on so with the child using the gestures and instead of wanting to use the words, the parents can add on words for them.
Yes, add on words. Give them time to process. Anything they attempt to do is a communicative attempt. The words that they may be using, or as she said, there are few words.
Yeah.
If there are those few words, the few words need to be encouraged in a sense that add on to that word. It's very difficult to give advice without actually understanding what's the behaviors that are taking place. But the main thing is to support that. That repetition.
Okay.
Following their interests, following their lead. So if they're taking their hand and showing them something, that is motivation because they want something.
Okay.
They're interested in something. So you could, they're reaching out for the jar of biscuit. Biscuit, get down. Take the biscuit out. Want more? More biscuit. Chocolate biscuit. More chocolate biscuit.
Okay. So you're adding words at each time.
Yes. Each time you're adding one word.
Okay. Okay.
And that could happen to another occasion with something else. If they're showing interest in something, get down to their level, take an interest in what they're interested in, and give them comment on that using your language. But comment in a very simple way, not sentences. 1, 2 words. Because it's easier. You can always expand at a later time.
Okay.
And give them the language that you would want to hear them using.
Mm.
So, biscuit. I want biscuit. There you are, biscuit.
Mm.
How many times did I repeat biscuit?
You've said it about
Yeah.
terms, yeah.
Yeah. Yeah.
Yeah. Very, very informative. Very informative. So, thank you so much, Mayuri. What kind of, we've talked about so much today, and I think if I just summarize what we've talked about, we started off by talking about normal childhood language development, because I think it's always
Yes.
important to know what's normal, what to expect at different times, and when you should be worried about a child's language development. We talked about that and talking about the fact that we need time. Every child's language is developing at different times, the trajectory. And one child may do it quicker than another, but just keep stimulating that language and imitating and providing the opportunity for the child to communicate. So, as parents, we have a role in that child's language. And we also talked about the fact that language development is not just focused on just the words. There might be other things going on. The child there needs to be listening. The child needs to have good attention and listening. And if there are problems there, we need to check, because could the child have a hearing problem, which case needs to seek help and get tested and checked. We talked about the differences between a child who is showing social communication concerns like autism spectrum disorder and the pattern of their language, as opposed to a child who just has a language delay. And the key thing was the social context, which as parents we should pay attention to,
Yes.
and just see how that is developing and what is happening, because that helps us as well in being able to understand the pattern of that speech and language development. So the social context. And also to remember that for children who are having delay in their language, we should be careful not to overload them with a lot of demands, because that tends to affect them and impact on how much they're responding. So
Yeah.
language is quite functional. It's useful in, we should make sure that, any adjustments or interventions that we're using is appropriate in, it's not just an isolated therapy session, but should
Mhm.
go into the different areas where the child needs to be, like the learning, the home, and, it's very important. We talked about sorry,
And it is supportive
it's supportive, yeah,
to use alternative forms
of
of communication.
yeah.
Yes.
Yes, we talked about that. That's very important.
Yes.
So it doesn't limit the child's development of language. It's I like that add-on. It's like, it's like
Yes.
an add-on. And I say it like
Okay.
way, if your vision is poor, you
Yes.
need glasses to be able to see properly.
Well, not just that. I mean, an analogy I can use is you've learned a language because you're going on holiday. A new language completely, even as an adult.
Yeah.
You've learned a new language. You've been going to evening classes. You've been having lovely to and fro social conversations with the people in your class, and you're quite confident. You get off the flight at your holiday destination, and suddenly you are struggling.
Yes.
You are struggling because that speech, that the language is spoken very rapidly. The environment looks unfamiliar. And what are you doing? You are then only able to understand the signs up on the door
Yes.
or something else. You are really struggling to process. You can't express yourself.
Yeah.
You've learned the language, but you still can't use it.
Yeah. I can relate to that very much.
So it's the same tools that we are using with our children to help them.
I can relate to that, love, when you have to rely on using the signs to be able
Yeah.
to communicate.
And the man in the passport queue is gesturing to you, go this way, do this.
Yeah, yes, I can.
You are understanding that more than the language
Yeah.
that's been spoken.
Yes, yes, absolutely. I can relate to that. And that's a beautiful analogy as well.
Yeah. Yeah.
And the other thing you mentioned is, which I think is very important for our families, is that having more isolated speech therapy sessions is not the answer.
No.
Is not the answer. And the fact that if the child's language is not progressing that quickly, not having more sessions does not revert that, as Mayuri has beautifully explained, that we need to tailor the support for the child and look at what that child needs and make it quite functional and make sure that that support is everywhere and anytime. I think I really like that it's
Yes.
anytime, everywhere, and that's really useful. And I think one other thing that you said is that a child having dual language or having multiple language spoken at home does not affect the child's language development. So it's not something that should limit the child.
No.
And also, when children speak more at home and less outside, we should explore the reason why. But we can
Yes.
also think about what is causing, what's the demand that's being placed on the child, what's the underlying reason, and explore that and
Yes.
seek help. And you beautifully ended with that bit about how we can promote language in children that are nonverbal and how we can add on and get to the child's level and add on language a bit at a time. But it's a very much something that we need to be part of as parents in that process. So it's been very useful information. I just want to, as a kind of last bit of tip for the families, how can parents support their child who's got language delay? What can they do? What practical things can they do at home? So these are children who's not necessarily nonverbal, but children whose language is not developing at the normal rate. What are the things they can do?
Play with them. Take interest in what they're playing, singing nursery rhymes, songs with them, books and stories, reading books together, discussing, things as they happen around them is very important. So you've been to the zoo, for example, you've been on a trip, but before you go to the zoo, you've looked at the books with and labeled the animals and become a little bit more familiar. When you get to the zoo, you are then modeling the language. You are following their interest. You come back and you are talking about it again. That is all lovely, rich language at all times. But it does require us to stop, spend that time with them, even if it's for 2 minutes, and get down to their level. Quite often you see a parent standing tall and the child is on the floor playing, talking to them. Get down, play with them,
Mm-hmm.
get face to face if you can, and they're comfortable with it.
Mm.
Join in. If you're reading a book, let them take the lead. Doesn't matter if they don't go through every page all the time. Let them flick through and what grabs their interest, spend time talking about it.
Amazing. Thank you so much, Mayuri. That's been an excellent session. Absolutely enjoyed
My
it.
pleasure.
I enjoyed it so much. And it's the questions that families ask very frequently, families I come across, families in clinic. And I think this has really been very helpful, including the advice that,
Yeah. What I often find, Dr. Takon, in my work is these questions are not unfamiliar. What I find is that quite often clinicians do not give the explanation to the parents as to why they need to be doing certain things with their child.
Yeah.
What is the reason behind the decision that had taken place?
Yeah.
And now I am aware that there are kind of supportive services emerging in the UK, which are outside of the NHS. They're voluntary services where parents can go and seek that help if need be.
Okay. So can you give an example of some of?
For example, in our work, Dr. Takon, in Hertfordshire, when you are struggling but concerned about your child's communication, social communication, you are on the waiting list still for autism. We have the Hertfordshire Hub
Yeah,
where you can go and seek support.
Yeah.
Because every, parents are experiencing, difficulties managing behaviors because every behavior is a form of communication.
Yes.
Is that behavior because of language delay? Is it because of some other underlying issue?
Yeah.
And they offer workshops to parents with variety of needs, like speech and language is part of it, but is integrated into understanding things. Then there are charitable organizations that kind of help parents to understand
Mm.
early developmental concerns. But I think parents should not be, frightened to ask questions that help me understand.
Yeah.
Help me understand the decision that you've made. What's the reason for that?
Yeah. Yeah.
Speech and language therapists that I know and I have worked with over the years would be able to give them that answer.
Yeah. It's very important for parents to understand. I think a lot of parents, once they understand, they know, it's like anything. If you're giving a medication, people want to understand what that medication is
Absolutely.
supposed to do.
And it's also parents hear the same message but in a different way.
Yeah.
From different professionals. So then the health visitor may have said one thing, but it's the same thing they've said, but they've used it again, talking about language, they've used a different form of language.
Yeah.
The teacher has used a different form of language, but they're talking about the same thing.
Yeah.
The speech and language therapist has used the same thing, but I think it is making those connections
Yeah.
for the parents.
Yeah, that's true. And the other thing I wanted to say is families one of the key things or the earliest things we always advise is checking the child's hearing. So
Yeah.
if there's speech and language delay in your child, one of the things you can do even before the child is seen by the therapist is at least get the child's hearing checked, because it might just be something, that can be, rectified quite quickly.
Yeah.
So it's important that you see your doctor, you get a referral to the hearing team so that
Yeah.
they check the child's hearing. That's very important. That's something parents should do.
Yes, and even a speech and language therapist in early years, that's the first thing that they will ask for is clarification around the hearing test.
And sometimes children who have challenging behavior,
Yes.
a lot of them, it's like you said, language is a form of communication. And some of the frustrations they might have, which comes out in the behavior, is
Yeah.
when they're not being understood, they can't communicate their needs, and they're frustrated. And
Yeah.
I have seen that where language improves, communication improves, that child's behavior becomes
Mhm.
better. So it's something for
That's
us to
right.
think about, that a child who's got challenging behavior, part of the reason might just be the language and communication difficulties.
Yes. Yes. And that's when support, help is needed.
Yeah.
To identify what can help
Yes.
that young person to communicate more effectively.
Yeah.
It doesn't always have to be verbal language, but it could be many other means as well, support.
Yeah. Thank you, Mayuri. Thank you. I'm very sure our audience would have lots of questions. You've mentioned some of the facilities that are emerging, which is great, because looking at the long waiting list, I think if parents can access some support, that would be lovely. So I think what would be helpful is parents checking in their local county website,
Yes.
because
County and the NHS website as well.
and the NHS website.
For example, in my current role, we've only just launched at a universal and targeted level sensory processing workshops for parents to understand how sensory processing impacts the child's ability to engage
Yeah.
in learning and functioning in everyday activities and tasks.
Yeah.
And again, that has an impact on language.
Yeah, absolutely. Thank you so much. So we do recommend families to look at their local services,
Yes.
the NHS website.
Each local area will have their own different way of
Yeah.
offering the services.
Thank you. If you do have questions, please send them to our email.
Sorry, Dr. Takon, just to help the parents, if they go to the local speech and language therapy website, those websites will have the information that the generalistic kind of advice and information that I've been talking about on there.
Okay.
There'll be lots of advice on there
So
for parents to follow.
okay.
Yeah. Every health authority, speech and language therapy service should have that information on their website.
Okay. Okay, that's very useful. Thank you so much. And thank you everyone for joining in today's session. Thank you. As we always say, early intervention leads to better outcome. And early intervention can only be achieved by early diagnosis. So thank you for listening into the series today. I know some of the things we've talked about today would probably have generated some questions or need to seek clarification. So I'm happy to take questions, and I'll invite you to send your questions to eim@drtakon.com. Thank you for listening in.